Welcome to the Just Hard podcast, real nurses, real talk, real life, where we take the nursing textbook and drop it right into the hospital unit, where real nurses have real conversations about the tough stuff. Because in nursing, hard isn't the enemy, it's just the making of you.
We're your hosts, Chelsea Justice
And Lisa Harding.
Two nurses who believe in teaching with honesty, heart, and a whole lot of practical wisdom. We know that nursing school isn't just challenging, it's transformative, and we're here to help make that transformation clearer, more doable, and yes, even a little fun.
Every episode, we'll break down the hardest concepts in nursing, show you how they actually show up in practice, and give you the tools to think like the nurses you're becoming. We will share our real-world stories, the lessons we learned the hard way, and the moments that pushed us and our students to grow.
So settle in, breathe deep, and remember,
it's just hard, and we can do hard things. Let's get started. Today's episode is Just Hard, Real Nurses, Real Talk, Real Life, the Law and Order SVU Special Virus Unit.
In the human body, viral offenses are considered especially dangerous. In the immune system, the detectives who investigate these relentless pathogens are members of an elite squad known as the Special Virus Unit.
These are their stories.
The call came in late, 21 days after exposure, a routine screening until it wasn't. A rapid test came back reactive. The patient felt fine. No visible illness, no obvious symptoms. But inside the immune system, the damage had already begun. This wasn't fear. This wasn't judgment. This was just the case.
Dun, dun, dun.
We've got a fresh case. Rapid HIV test just came back reactive.
HIV is a retrovirus. It doesn't just infect cells, it rewrites them.
It causes chronic, persistent destruction of immune cells.
Specifically CD4 helper T cells and macrophages. Those are your host cells.
Without treatment, those cells are depleted.
And the case escalates to AIDS.
So who's the victim? When we say CD4 cells in HIV, we're talking about CD4 helper T cells.
They're the immune system's 911 dispatchers.
They're active B cells, CD8 killer T cells, and macrophages.
HIV depletes these CD4 cells, but while they're alive,
they produce massive amounts of virus.
Macrophages are long-lived tissue-based cells.
They live in mucous membranes and inflammatory tissue,
making them perfect host cells for HIV.
HIV hides inside the macrophages.
Like a squatter in an abandoned warehouse, protected, persistent.
The result?
Immunodeficiency by design. So how is this disease transmitted and what is the epidemiology? HIV has one requirement. It has to get into the bloodstream.
Transmission occurs through blood, semen, preseminal fluid, vaginal fluid, rectal fluid, and breast milk.
Not hugging.
Not kissing.
Not toilet seats.
And not sharing pasta.
I think the only thing you can really get from a toilet seat is like crabs.
Ew, no, don't put me down for that. No.
So you cannot get HIV from general contact. It has to enter the bloodstream somehow. Higher rates are seen in men who have sex with men.
IV drug use remains a major risk factor.
African Americans are also disproportionately affected.
Yeah, it's one of the social determinants of health. Mm-hmm. Occupational exposure risk, is there any there?
Pretty low, about 0.36%. So low statistically, but pretty scary if you have an exposure, if you're the one that happens to.
No kidding. I think it's time for a commercial break.
Some cases don't start with a diagnosis. They start with prevention.
Are you in the dating world worried HIV might slide into your bloodstream like a red flag sliding into your DMs?
Introducing Truvada for pre-exposure prophylaxis, PrEP, one of the most effective HIV prevention tools we have.
PrEP is for people who are HIV negative and want to stay that way.
PrEP prevents HIV.
Not bad decisions.
Not chaos.
And definitely not your type.
It only works when taken every single day.
This is prevention, not astrology.
If you stop taking PrEP, protection stops too.
Truvada, case closed.
So let's talk about the HIV life cycle. So every case starts with an exposure.
The virus enters the bloodstream.
It finds a host cell, remember your CD4 or a macrophage, and then it fuses to it.
HIV releases its RNA into the cell.
Reverse transcriptase converts RNA into viral DNA
That DNA enters the nucleus.
and turns the cell into a factory.
New viral RNA and proteins are made by that factory.
Assembly, budding,
Protease matures the virus.
organized, stepwise, relentless. And then the stages of the HIV infection. HIV actually goes down a continuum, right, Lisa?
It sure does. Yeah, it starts one and then goes all the way. So it begins with acute infection. This often feels like mono or just the basic flu.
Yeah, so they might have fever, fatigue. They might even have a rash, and they have a very high viral load. But then they might kind of feel better for a while and not follow up.
Yeah, when that viral load is high, this is when transmission risk is the highest.
So they probably don't even know they have it.
Correct.
And then this becomes a chronic infection.
Yeah, this is stage 1. This is asymptomatic, but if we test you, your CD4 cells are above 500.
So the body is still basically able to keep enough CD4 cells to outnumber the HIV at this point.
Correct.
All right. So then stage 2, now the patient becomes symptomatic and your CD4 cells start to drop. And this is now when they're between 200 and 500.
Yeah, without treatment, what happens?
We progress to AIDS.
This is defined by CD4 count less than 200.
Or one of the AIDS-defining illnesses, which are known as opportunistic infections. One opportunistic infection is PCP pneumonia, pneumocystic. Can you help me with that one?
Pneumocystic carnii pneumonia.
Thank
I'm probably
you.
pronouncing it wrong, way wrong, but hey, whatever.
This is actually the most common AIDS-defining illness. So an opportunistic infection is something that you wouldn't normally get sick from if your immune system is working.
Yeah, the immune system is strong enough to fight off these little nasty invaders. Another opportunistic infection is cytomegalovirus, or CMV. Tuberculosis is also one, and then toxoplasmosis.
What about oral thrush?
Misdemeanor.
Right. It has to go below the mouth, down into the esophagus, or even the bronchial tree in order for it to be considered opportunistic.
Yeah, that's a felony once it gets down, though.
AIDS
It's
defining. So Kaposi sarcoma also requires a HHV8 exposure. Kaposi sarcoma, you get like those little lesions on the skin, and that's actually a type of cancer, but it's an opportunistic one.
Yeah, but that one only appears when the immune control is lost. So that's really important to count those CD4 cells and what is my immune system doing at that.
Right. So HIV virus progresses down a continuum, and then once that CD4 is less than 200 or they have an opportunistic infection, they have AIDS.
It's time for another commercial break.
Nystatin, swish and spit. White patches in the mouth?
Time for a classic.
Nystatin,
Swish and spit.
Swish, gargle, rotate, meditate.
And spit. Do not swallow this.
Above the throat only.
Below?
Not our jurisdiction. And one more commercial from an unofficial sponsor.
PEP. Some cases don't wait. Exposure just happens. Time matters.
PEP, pre-exposure or post-exposure prophylaxis, must start within 72 hours.
Yeah, this is a 28-day course of triple antiretroviral therapy.
This is urgency, not watchful waiting.
PEP. Time matters.
So the PEP, the post-exposure prophylaxis, that would be something like if I know that I had an exposure where the person, maybe we don't know their status, or maybe we're in the hospital and we do know their status, and then we can decide if we want to take the post-exposure prophylaxis.
Or it's like a Tinder date. Things are going well. After the date, they confess. I could have murdered you.
So what are some complications of the therapies and treatments themselves? There's actually something called IRIS, immune reconstitution inflammatory syndrome.
It occurs after you start antiretroviral therapy. ART, antiretroviral therapy, is the treatment that we use for patients with HIV.
So the immune system wakes up
and overreacts to existing or latent infections.
And the system's back online, and it has opinions.
ART, or antiretroviral therapy, usually continues.
Supportive care is the key. Don't ever stop taking your meds.
Right. Especially your HIV meds, or we're going to have some resistance and lots of complications. And that goes to the PrEP, too, the
pre-exposure,
pre-exposure prophylaxis. Also, they're worried about resistance if the person is not adherent with that medication regimen. So what are some nursing interventions?
Now, this is where nursing changes the outcome.
Education and medication adherence is key.
Monitor that CD4 count and the viral load.
Assess liver and kidney function. These meds are not nice to the rest of our body.
And then, of course, prevent infection and transmission.
No live vaccines. Our immune system is compromised.
And provide psychosocial support.
Because this is not just a virus, it's a person living with HIV.
Right. So now we want to say the person is living with HIV, kind of like with suicide. Professor Cedalene taught me that. Like, we don't say that they committed suicide anymore. We say this person died by suicide. So we want to make sure that we say that they're living with HIV. You don't want to label them and make that feel like part of their identity.
Labels are not nice.
Not nice.
With treatment, viral load can become undetectable.
Undetectable does not necessarily mean cured, or it does not mean cured at all. They still have it. Even if their viral load is undetectable,
But
it's
it
still
does
there.
mean that they can't transmit it.
Yes. So they're taking their medications and they have to continue to take those medications. All right. Thanks for joining us today. This episode was not about fear.
It was about knowledge.
It's
just
just
hard,
hard.
and you can do hard things. Special shout out to our special guest on this episode, Jesus DJ Aguirre. Did I say your last name right? Aguirre. Of course I was going to mess it up. Pronunciations aren't my thing.
That's okay. That's
Yeah.
all right.
Thank you for joining us
Well,
today.
Thank you for having me.
See you
guys.
next episode.